Summer 1944, Wisconsin and California. As Allied forces advanced across the Pacific, captured Japanese medical officers were transported to mainland POW facilities under Geneva Convention protocols. Unlike combat soldiers, medical personnel received specialized treatment, including placement in hospital environments, where the U.S. military sought to demonstrate adherence to international law while managing thousands of prisoners across the continental United States. They had prepared themselves for execution, not for medical journals. When Dr. Hiroshi Tanaka stepped off the transport ship in San Francisco Bay, his hands still bore traces of blood from the field hospital at Saipan, where American shells had torn through canvas and flesh alike. He expected brutality. He expected shame. What he encountered instead would fracture everything he believed about the enemy and about himself. This is the story preserved in declassified documents and forgotten testimonies, a narrative known as Japanese POW doctors couldn't believe American hospitals treated them with respect. The war had taught him how to die with honor, but it had never prepared him for the possibility of living with doubt. The train rattled westward through terrain Dr. Hiroshi Tanaka had only seen in propaganda films. Landscapes painted as the homeland of demons who knew nothing of Bushido or medical ethics. He sat rigid in the wooden seat, wrists bound loosely with rope that seemed almost apologetic in its application. Beside him, Nurse Aiko Sato stared through the window with eyes that had witnessed too much death in too few years. Neither spoke. Speech felt like betrayal, as if acknowledging their survival somehow dishonored the men who had chosen grenades over captivity. The rhythmic clacking of wheels on rails became a metronome, counting down to an unknown fate, each rotation pulling them further from everything they understood about duty and sacrifice. Through the dusty glass, American farmland stretched in impossible abundance, fields of wheat golden under August sun, barns painted red as fresh wounds. Tanaka's medical training forced him to catalog details, even as his spirit recoiled from the evidence before him. A country untouched by bombardment, children playing near rail crossings, women hanging laundry without fear of air raids. The propaganda had promised a nation on the brink of starvation, desperate and cruel. Instead, prosperity mocked every lesson drilled into him at Osaka Medical College, where professors had sworn that American doctors were butchers who valued efficiency over the sacred trust between healer and patient. He pressed his palm against the window, feeling the vibration of the train through glass, wondering if this journey would end in a shallow grave or something far more confusing. The guards barely watched them. Young men in olive uniforms who smoked cigarettes and played cards, occasionally offering water with gestures that seemed genuine rather than mocking. One soldier, barely 20 with freckles across his sunburned nose, had attempted broken Japanese phrases from a pocket dictionary, asking if they needed a blanket or food. Tanaka had refused, pride preventing acceptance even as his stomach contracted with hunger. Buriko had nodded, taking the offered sandwich wrapped in waxed paper, and the look of relief on the young soldier's face had been disarming. It suggested that these Americans somehow cared whether their prisoners suffered, a concept that contradicted everything Tanaka understood about the nature of warfare and the permanent divide between victor and vanquished. As darkness fell and the train's lights flickered on, Tanaka allowed himself to close his eyes, though sleep remained impossible. Behind his eyelids, he saw the faces of patients he had failed to save on Saipan, men whose wounds exceeded his limited supplies of morphine and sulfa drugs. He had performed amputations with sake as anesthetic, had sewn torn flesh with fishing line, had watched infection-claimed soldiers who might have survived with access to the medicines he had read about in smuggled American medical journals. Those journals, contraband that could have cost him his commission, had revealed a world of penicillin and blood transfusions and surgical techniques decades ahead of Imperial Army capabilities. Now he was being delivered into the heart of that world, not as a student but as a prisoner, and the irony tasted bitter as copper in his mouth. The train began to slow, brakes squealing as they approached a station bathed in artificial light. Through the window, Tanaka glimpsed a sign, Camp McCoy, Wisconsin. Armed guards stood on the platform alongside men in white coats, medical insignia visible even at a distance. One of the white-coated figures, A tall man with silver hair and the bearing of someone accustomed to authority stepped forward as the train doors opened. His expression was neither cruel nor kind, simply professional, the face of a surgeon assessing a difficult case. When he spoke, his voice carried across the platform with unexpected clarity. "Gentlemen, ladies, you are medical personnel and you will be treated as such." Tanaka felt something crack inside his chest, a fissure in the armor of certainty he had worn since enlisting. And for the first time since capture, he wondered if survival might be more complicated than death. The hospital wing smelled wrong, antiseptic and almost aggressive in its cleanliness, nothing like the copper blood and gangrene stench that had defined Tanaka's last 3 years of practice. White tiles reflected fluorescent lights with painful brightness, and the corridors stretched in geometric perfection, unmarred by shrapnel holes or fire damage. Nurse Sato walked beside him, her steps hesitant on floors polished to mirror shine, as if afraid that touching anything might reveal the illusion and return them to the nightmare they had left behind. An American nurse in crisp uniform led them through hallways where supply closets stood open, revealing shelves stocked with bandages, medications, and surgical instruments in quantities that seemed obscene. Tanaka's hands trembled slightly as he caught sight of glass bottles labeled with drugs he had only read about, wondering if this abundance was theater designed to humiliate prisoners with displays of enemy superiority. Dr. Robert Williams waited in what appeared to be a teaching amphitheater, a semicircular room with tiered seating facing a central demonstration table, equipped with modern surgical lights. He stood with arms crossed, his white coat bearing stains that suggested recent work rather than ceremonial dress. When he spoke, his English was measured, accompanied by a translator who rendered his words into formal Japanese that sounded strange after months of hearing only battlefield dialect. "You are doctors and nurses. Your skills are valuable, and they will not go to waste here. You will observe our procedures, assist where appropriate, and in exchange, you will learn techniques that may serve you after this war ends." The statement hung in the air like a challenge, implying a future beyond captivity that Tanaka had not dared to imagine. The first demonstration involved a surgery already in progress, visible through an observation window that looked down into an operating theater. An American soldier lay on the table, his abdomen open to reveal damage from what Williams explained was a training accident involving a jeep collision. The surgical team moved with choreographed precision, each member anticipating the other's needs, while machines Tanaka didn't recognize beeped steadily, monitoring vital signs with technology that seemed lifted from science fiction. He watched as the lead surgeon called for blood transfusion, and within seconds, bottles of matched plasma appeared, administered through rubber tubing with casual efficiency. On Saipan, Tanaka had watched men bleed out because he possessed neither the equipment nor the supply chain to provide such intervention, had held intestines in place with his bare hands while praying for miracles that never came. Williams gestured for them to sit in the amphitheater seats, then began lecturing as if they were medical students rather than enemy prisoners. He drew diagrams on a chalkboard, explaining the principles of sterile technique, the discovery of penicillin, the methods for managing shock and infection that had reduced American surgical mortality rates to levels that seemed impossible. Tanaka found himself leaning forward, forgetting his captivity, his mind automatically cataloging information and comparing it to the desperate improvisations he had employed in the field. Beside him, Sato was sketching notes on a pad provided by their escort, her nurse's training overriding whatever reservations she harbored about learning from the enemy. The translator struggled to keep pace with Williams's technical vocabulary, occasionally pausing to find equivalent terms that didn't exist in Japanese medical lexicon. When the lecture ended, Williams approached them directly, his expression unreadable. He pulled a thick textbook from a shelf and placed it in Tanaka's hands, the weight of it substantial and real. "Harrison's Principles of Internal Medicine, 1944 edition," Williams said through the translator. "Consider it alone. Read it, question it. Medicine advances when we challenge assumptions." Then he did something Tanaka would replay in memory for decades. He extended his hand for a handshake, a gesture of professional equality that violated every boundary Tanaka understood, about the relationship between captor and prisoner. Tanaka stared at that outstretched hand, feeling the eyes of Sato and the other Japanese medical personnel watching him, waiting to see if he would accept this offering or reject it as manipulation. His fingers closed around Williams's palm, the texture of calloused skin against calloused skin, two surgeons who had both known the weight of lives depending on their decisions. In that moment, something shifted. Not forgiveness or friendship, but a recognition that the operating theater acknowledged no flags, only the desperate mathematics of saving or losing human lives. Lieutenant Sarah Mitchell appeared the next morning with a cart stacked with medical journals, her smile professional, but genuinely warm in a way that unsettled Tanaka more than hostility would have. She had been assigned as their liaison, responsible for coordinating the Japanese medical staff's integration into the hospital's educational program. Her Japanese was surprisingly competent, learned during 2 years stationed in Tokyo before the war, and she navigated the language's formal registers with care that suggested respect rather than condescension. Dr. Williams thought you might appreciate current research, she explained, gesturing to publications that included the New England Journal of Medicine, JAMA, and several surgery periodicals dated within the last 6 months. The gift felt surreal, offering access to enemy military medical advances as if information itself existed outside the boundaries of warfare. The reading room they were provided was small but comfortable, windows overlooking a courtyard where off-duty staff played softball in late afternoon light. Tanaka sat with 3 other captured Japanese doctors, all of them initially silent as they processed the strangeness of their situation. One, a Navy surgeon named Kenji Matsumoto, finally broke the silence with a whispered observation. They are either supremely confident or supremely foolish to educate us. Another, an army physician called Yoshida, nodded grimly. Perhaps they believe we will never return home to use this knowledge. But Nurse Sato, always more pragmatic, simply opened the nearest journal and began reading an article on battlefield triage innovations, her finger tracing English words with the determination of someone refusing to waste an opportunity, regardless of its source or motive. Tanaka chose an article on penicillin administration, the miracle drug that had revolutionized infection treatment in ways that made traditional methods seem medieval. The text described dosing protocols, clinical trials, production methods that had been scaled to industrial levels, supplying not just American forces, but Allied militaries across multiple theaters. He calculated in his head the number of Japanese soldiers who had died from infected wounds, sepsis claiming men who had survived initial trauma, and the mathematics of loss became overwhelming. The Americans had possessed this capability for years, while Imperial Army doctors had relied on prayer and sulfa drugs that were often expired or counterfeit. The disparity wasn't just technological, represented a fundamental difference in how each nation valued the lives of its servicemen, one side willing to invest massive resources in keeping soldiers alive, while the other romanticized death as the highest form of loyalty. Days blurred into weeks, and the routine of reading, attending lectures, and observing surgeries created a rhythm that felt dangerously normal. Williams proved to be a demanding teacher, asking questions during ward rounds that forced Tanaka to articulate his diagnostic reasoning in English, pushing him to justify treatment decisions with evidence rather than tradition. Other American doctors joined the informal seminars, specialists in orthopedics, neurosurgery, and infectious disease, who seemed genuinely interested in the Japanese physicians' perspectives on tropical medicine and field improvisation. The exchanges became almost collegial, professional disagreements debated with the intensity of colleagues rather than adversaries, and Tanaka found himself forgetting for minutes at a time that these men wore the uniform of the nation his emperor had declared eternal enemy. One evening, Lieutenant Mitchell brought tea. Real Japanese green tea somehow procured through military supply channels, and sat with them in the reading room as sunset painted the Wisconsin sky in colors that reminded Tanaka of home. She asked about their medical training, listened without judgment as they described the resource scarcity and hierarchical rigidity of imperial military medicine, shared stories of her own nursing education, and the challenges of treating traumatic injuries that textbooks couldn't fully prepare anyone to handle. When she left, she placed her hand briefly on Sato's shoulder, a gesture of solidarity that transcended national boundaries, one nurse acknowledging another's burden. Tanaka watched Sato's expression shift, seeing perhaps the first crack in the defensive shell she had maintained since capture, and he wondered if kindness might be the most devastating weapon America possessed, more destructive to Japanese military ideology than any bomb. Winter arrived with Wisconsin brutality, snow accumulating in drifts that transformed the camp into a monochrome landscape that felt alien to men raised in temperate climates. The hospital ward grew busier as seasonal illnesses and training accidents filled beds, and Dr. Williams made a request that struck Tanaka as either remarkably progressive or calculatedly strategic. He asked the Japanese doctors to participate in actual patient care, supervised but substantive, treating American servicemen under the same protocols they had been observing for months. The proposal sparked heated debate among the POW medical staff, some viewing it as collaboration with the enemy, others seeing it as the fulfillment of their Hippocratic obligations that superseded politics. Tanaka found himself in the uncomfortable position of defending participation, arguing that medicine recognized no nationality, even as his own certainty wavered with each word. The first patient assigned to Tanaka was a 19-year-old private from Iowa, suffering from pneumonia, that had progressed despite initial antibiotic treatment. The young man's fever had spiked to dangerous levels, and his chest x-rays showed consolidation that suggested potential abscess formation. Tanaka stood at the bedside, acutely aware of Lieutenant Mitchell observing from the doorway, of Dr. Williams reviewing the chart over his shoulder, of the patient's blue eyes watching him with exhaustion, but no apparent fear. He performed the examination with hands that had learned their craft in Japanese teaching hospitals, palpating lymph nodes, percussing lung fields, listening through a stethoscope to breath sounds that wheezed and crackled with fluid accumulation. The diagnostic process was universal, the language of pathology transcending the languages spoken by doctor and patient. Treatment required adjusting the antibiotic regimen and considering whether surgical drainage would be necessary if the abscess continued to develop. Tanaka discussed options with Williams in careful English, presenting his clinical reasoning and recommended modifications to the current protocol. Williams listened, asked pointed questions, then nodded approval, making only minor adjustments to the plan. Over the following week, Tanaka monitored the patient's progress, adjusting medications, ordering follow-up imaging, experiencing the peculiar intimacy that develops between doctor and patient, regardless of circumstances. The private improved steadily, fever breaking, breath sounds clearing, and on the day of his discharge, he shook Tanaka's hand with genuine gratitude, saying through the translator that he hoped Tanaka would make it home safely when the war ended. The simple humanity of that wish cut deeper than any accusation could have. More patients followed, a steady stream of young men with injuries and illnesses that reminded Tanaka of the Japanese soldiers he had treated in field hospitals, the same fears and hopes visible in faces that differed only in coloring and feature. He began to understand what Williams had been teaching all along, that the operating theater was perhaps the only truly democratic space in warfare, where skill mattered more than nationality, and suffering required response regardless of uniform. Nurse Sato had reached similar conclusions working alongside American nurses, learning techniques for wound management and patient comfort that would have been dismissed as wasteful softness in imperial medical culture. They discussed these revelations in whispered Japanese during rare private moments, both of them grappling with the cognitive dissonance of respecting people they were supposed to hate. The library sessions continued, growing more sophisticated as language barriers eroded and professional trust developed. Williams began presenting case studies that had no single correct answer, complex ethical scenarios that forced discussion of resource allocation, triage principles, and the philosophical foundations of medical decision-making. Tanaka found himself arguing with American doctors over theoretical dilemmas, his perspective shaped by scarcity, offering insights that complemented their experience with abundance, and he realized with uncomfortable clarity that he had become part of something resembling a genuine educational community. On a February night, when Wisconsin wind howled around the hospital buildings and snow obscured the compound's perimeter fences, Dr. Williams handed Tanaka another book, this one a personal copy worn from use, Surgery of Modern Warfare. Inside the cover, Williams had written in precise script, "To Dr. Tanaka, may your hands heal more than war can destroy." It was an inscription that acknowledged both their present roles as enemy physicians and a future possibility of reconciliation. And Tanaka held the book like a fragile treaty, uncertain whether what he felt was hope or betrayal. Spring transformed the Wisconsin landscape into something that reminded Tanaka painfully of cherry blossom season in Kyoto. Though the flowering trees here were different species, their petals whiter and their fragrance less subtle. He had been at Camp McCoy for nearly 8 months now, long enough that the rhythms of American hospital routine had become familiar, long enough that he sometimes caught himself thinking in English medical terminology before translating back to Japanese. The disorientation of this linguistic drift troubled him during sleepless nights when he lay in his bunk, wondering if adaptation constituted a form of surrender, more complete than the physical capitulation that had brought him here. Dr. Williams had expanded the educational program, now including surgical practicums where Tanaka and 2 other Japanese doctors performed procedures under supervision, their hands guided by American expertise through techniques that represented decades of advancement beyond imperial military medical capabilities. The operation that would haunt Tanaka involved a young Marine corporal who had been injured during amphibious training exercises. His leg crushed when a landing craft malfunctioned and pinned him against the dock. The damage was severe, multiple compound fractures with significant soft tissue destruction, and the initial assessment by American surgeons suggested amputation as the most prudent course to prevent infection and preserve the patient's life. But Williams called Tanaka to the preoperative conference, asked for his opinion based on his extensive field experience with traumatic injuries, and Tanaka found himself arguing for limb salvage despite the risks. He described techniques he had improvised on Saipan, methods born of desperation and the knowledge that prosthetics were scarce in the Imperial Army. Ways of debriding devitalized tissue and stabilizing fractures with minimal hardware that might give this young man a chance to keep his leg. Williams listened with that characteristic intensity that Tanaka had learned to recognize as genuine intellectual engagement, not merely polite tolerance of a subordinate's input. The surgical team debated for 30 minutes, weighing infection risk against functional outcome. And ultimately, Williams decided to attempt the salvage procedure incorporating elements of Tanaka's suggested approach. The surgery lasted 7 hours, Tanaka assisting as second surgeon, while American specialists handled anesthesia and nursing support, the operating theater becoming a space where nationality dissolved into shared focus on the technical problem before them. He felt the old familiar concentration, the narrowing of consciousness to the field of cut flesh and exposed bone, his hands remembering skills honed under fire now applied in conditions of relative luxury, with adequate lighting, proper instruments, and sufficient time to work with precision rather than desperate speed. The Marine's leg was saved, though recovery would be long and the final outcome uncertain for months. During the post-operative period, Tanaka made daily rounds, monitoring for signs of infection or vascular compromise, adjusting pain management protocols, and discussing rehabilitation plans with the physical therapy staff. The patient, semi-conscious in those first days, never knew that an enemy doctor had advocated for his leg and participated in its preservation. But Lieutenant Mitchell knew, and she made a point of thanking Tanaka privately. "You gave him a gift," she said in her careful Japanese, "the possibility of walking normally again. Maybe dancing with his girl when he gets home." Her words carried weight, because she understood what Tanaka had sacrificed in that operating theater. The comfortable distance that came from viewing Americans as abstract enemies, rather than individual human beings, whose futures now depended partly on decisions he had made. As weeks passed and the Marine's leg healed without major complications, word spread through the camp about the successful collaboration, and something shifted in how the American medical staff interacted with their Japanese counterparts. Respect that had been grudging or performative became genuine. Invitations to informal discussions over coffee in the staff lounge. Shared frustrations about bureaucratic inefficiencies and supply chain problems that transcended national differences. Nurse Sato mentioned to Tanaka that American nurses had started asking her to teach them Japanese phrases, not for interrogation purposes but simply to communicate more effectively. With the growing number of Japanese patients, the medical staff anticipated treating as the war in the Pacific intensified. The implications were sobering. These Americans were preparing to extend the same quality of care to future enemy wounded that they provided to their own troops, a concept so foreign to imperial military doctrine that Tanaka struggled to fully process its significance, wondering if this represented either the highest form of civilization or a dangerous naivety that warfare would eventually crush. Summer heat arrived with Midwestern intensity, transforming the hospital wards into spaces where oscillating fans provided only marginal relief, and the scent of antiseptic mingled with perspiration. News from the Pacific Theater filtered through official channels and whispered rumors, tales of battles on islands whose names Tanaka recognized, campaigns that were systematically dismantling the defensive perimeter Japan had fought so desperately to establish. Each American victory meant more Japanese wounded, more prisoners, more men like himself facing the cognitive dissonance of receiving care from those they had been trained to kill. Dr. Williams mentioned casually during morning rounds that Camp McCoy would soon receive a large influx of Japanese medical personnel captured during recent operations, and he wanted Tanaka's help in designing an orientation program that would ease their transition from combat to captivity, from expecting death to confronting the bewildering reality of American medical hospitality. The request placed Tanaka in an impossible position that crystallized all the contradictions he had been living with for nearly a year. To assist Williams meant actively participating in America's POW system, becoming complicit in efforts to demonstrate Geneva Convention compliance, and perhaps to soften Japanese prisoners' resistance to American ideological influence. Yet to refuse meant abandoning fellow Japanese medical personnel to confusion and fear, denying them the knowledge he had gained about how to navigate this strange environment where enemies offered textbooks instead of torture. He discussed the dilemma with Nurse Sato late one evening in the hospital's small meditation garden, a space created by a thoughtful landscape architect who had included stone arrangements reminiscent of Japanese aesthetics. She listened to his tortured reasoning, then offered perspective sharpened by her own months of cultural adjustment. "We cannot change that we are prisoners, Tanaka-sensei, but we can choose whether our captivity serves only American purposes or also serves our own people's survival and eventual return home." The new arrivals came in July. 36 Japanese medical personnel captured during fighting on Tinian, their faces carrying the same mixture of shock and resignation that Tanaka remembered from his own initial transport. He stood with Williams and Mitchell as the group was processed, watching younger versions of himself confronting the sanitized efficiency of American military bureaucracy. When it came time for orientation, Tanaka spoke to them in Japanese, explaining the camp's rules and medical program without embellishment or propaganda, simply laying out the reality they would face. He showed them the library, the operating theaters, the wards where they might be asked to treat American patients, and watched their expressions cycle through disbelief, suspicion, and eventually a tentative curiosity that mirrored his own trajectory. One young doctor, barely 30 with eyes that had seen too much death too quickly, asked the question Tanaka had anticipated. "Sensei, how do we maintain our honor while learning from the enemy?" The answer Tanaka gave was one he had been constructing mentally for months, tested against every interaction with Williams, and refined through countless hours of introspection. "Honor," he said carefully, "lies not in ignorant rejection of knowledge, but in the application of skill to preserve life regardless of circumstances. The Americans have advanced techniques that could save Japanese soldiers if we survive to practice medicine again. To refuse this education out of pride would be to doom future patients to preventable deaths. That," he concluded with conviction that surprised even himself, "would be the true dishonor." He watched his words land, seeing some of the new prisoners nod while others remained skeptical, and he understood that each man would have to navigate this moral territory individually, that there were no simple answers when warfare complicated the fundamental obligations of the medical profession beyond any ethical framework he had been taught. Dr. Williams integrated the new Japanese medical staff into the hospital's operations with practiced efficiency, and the compound settled into a strange routine where former enemies collaborated on saving lives with an earnestness that seemed to mock the ongoing war. Tanaka found himself teaching more than learning now, passing on surgical techniques and clinical knowledge to younger Japanese doctors while simultaneously continuing his own education in American methods. The role of bridge between two medical cultures felt appropriate somehow, using language and translation skills to facilitate understanding that transcended the political animosity, driving young men to kill each other on distant islands. Lieutenant Mitchell organized social gatherings in the recreation hall, evening sessions where Japanese and American medical personnel played chess or listened to music or simply talked about families and futures with the desperate normalcy of people trying to remember their humanity amid organized violence. One August evening, as Tanaka sat reviewing case notes for patients he would see the next morning, Williams joined him uninvited, carrying 2 cups of coffee and wearing an expression that suggested something more than casual conversation. "The war will end eventually," Williams said without preamble, his English deliberately simple. "When it does, Japan will need doctors who understand modern medicine, who can help rebuild a healthcare system that serves the population rather than just military priorities. What you're learning here, what you're teaching to the others, it matters beyond this camp, beyond this war." Tanaka accepted the coffee, tasting its bitter familiarity while processing Williams's words, recognizing in them both genuine concern and strategic calculation. The American military's long-term planning for post-war occupation and reconstruction that assumed Japan's eventual defeat. The coffee cup felt warm in his hands, solid and real, anchoring him to a present moment that contained both captivity and possibility. And he wondered if the future Williams described was prophecy or propaganda, hope or manipulation, or perhaps somehow all of these things simultaneously. Autumn arrived with colors that transformed Wisconsin forests into flames of red and gold, beauty that felt almost violent in its intensity, nature indifferent to human warfare and suffering. Tanaka had been at Camp McCoy for over a year now, a period that had fundamentally altered his understanding of medicine, nationality, and the boundaries between duty and pragmatism. News from the Pacific grew increasingly grim from the Japanese perspective. Island after island falling to American amphibious assaults supported by overwhelming naval and air superiority that made defense essentially impossible. He listened to armed forces radio broadcasts in the staff lounge, understanding enough English now to grasp the triumphant tone, as American commentators described battles at Iwo Jima and Okinawa, places where thousands of Japanese soldiers chose death over surrender, while he lived in relative comfort, learning enemy medicine and treating enemy wounded. The guilt settled in his chest like a physical weight, made heavier by the knowledge that his survival might ultimately serve Japan better than his death would have. Dr. Williams called a meeting of all medical staff, American and Japanese, in late October, to announce a new program initiative. The military had decided to formalize the educational collaboration, creating an official curriculum that would certify Japanese medical personnel in American techniques with documentation that would be recognized after the war. This camp, Williams explained through careful translation, has become something unprecedented, a medical exchange program conducted during wartime. What we've accomplished here proves that professional knowledge transcends political conflict, that the imperative to heal can overcome even the deepest national antagonisms. His words were measured, but Tanaka detected underlying emotion, as if Williams himself was surprised by what they had built within the constraints of captivity and military regulations. The certification program would require examinations, practical demonstrations, and written documentation that would create an official record of competency in modern medical practice, essentially credentialing enemy doctors in American healthcare standards. The proposal ignited debate among the Japanese medical staff, particularly among newer arrivals, who had not yet acclimated to the camp's unusual atmosphere. Some viewed certification as collaboration too explicit to justify acceptance of formal credentials from the enemy that implied acknowledgement of American superiority. Others, including Nurse Sato, argued pragmatically that documentation of their skills might prove valuable in an uncertain post-war future, tangible evidence of learning that could facilitate professional practice regardless of political circumstances. Tanaka found himself again in the role of mediator, helping his compatriots navigate the complex ethical terrain while privately acknowledging his own uncertainty. He had grown to respect Williams and many of the American medical staff, had witnessed firsthand the superiority of their techniques and resources. But respect and acknowledgement were very different from the formal acceptance that certification would represent. He spent a sleepless November night walking the compound's perimeter, permitted freedom of movement within the fenced boundaries that seemed less like imprisonment than protective custody as the months accumulated. Snow had begun to fall, early flakes drifting through darkness to settle on ground that would soon be frozen until spring. Tanaka thought about his wife and daughter in Osaka, wondered if they still lived, or if American bombing campaigns had claimed them as war claimed everything it touched. He thought about the Marine whose leg he had helped save, about the dozens of American patients he had treated over the past year, about the impossible mathematics of healing enemy wounded, while his own countrymen died for lack of the very medicines and techniques he had learned in captivity. The contradictions refused to resolve into comfortable certainty, and he finally accepted that perhaps they were not meant to be resolved, that the experience of this camp existed in moral territory where traditional concepts of loyalty and betrayal simply did not apply. In December, as 1945 approached with whatever unknown horrors or resolutions it might bring, Tanaka completed the certification examination, his hands performing surgical procedures under Williams' observation, while a review board of American military physicians evaluated his competency. He passed with distinction, receiving documentation that stated in formal bureaucratic language that Dr. Hiroshi Tanaka had demonstrated proficiency in modern surgical techniques, infectious disease management, and trauma care according to contemporary American medical standards. The certificate was signed by Williams and countersigned by the camp's commanding officer, an official document that represented either betrayal or survival, or perhaps a third option that transcended such binary choices. That evening, in the staff lounge where Japanese and American medical personnel had learned to coexist, Williams offered a toast with smuggled sake that Lieutenant Mitchell had somehow procured through mysterious supply channels. "To medicine," Williams said simply, raising his cup. "The only war worth fighting." Tanaka raised his own cup, meeting Williams's eyes across cultural and political chasms that nevertheless narrowed in that moment to the width of shared professional commitment, and he drank, tasting rice wine and complexity, honoring something he could not quite name, but recognized as profoundly important to whoever he would become when the war finally ended and he faced the task of living with everything he had learned in captivity. The historical record shows that POW medical personnel at camps like McCoy did receive unprecedented educational opportunities, and many returned to Japan after surrender to become leaders in modernizing Japanese healthcare during the post-war reconstruction. Dr. Williams's model of treating medical personnel as colleagues rather than mere prisoners represented a strategic calculation about post-war influence, but it also reflected genuine belief in the universality of medical ethics. For men like Tanaka, the experience created a permanent internal division, loyalty to their nation coexisting uneasily with respect for former enemies and recognition that the healing arts acknowledge no permanent borders, only the shared human vulnerability to suffering and the moral imperative to respond with skill and compassion regardless of circumstance.